Work. That's good for today. Good job. And?
Feels better.
No pain?
No.
There you go.
No.
That's good. So the first sumo deadlifts in a couple months,
Yeah.
pain-free, no pinching pain.
Right.
There you go. On the right track.
Shelby came to see me with left hip pain. While previous physical therapy had helped somewhat to decrease symptoms during day-to-day life, she still could not get into a deep sumo deadlift start position without a pinching pain in the front of her hip. When I examined her hip mobility, she had a ton of hip internal rotation on her right, but limited available motion on her left, as you can see. She could easily bring her knee to her chest on her right side, but I could only bring her knee slightly past 90 degrees on her left side before she started to feel a pinching blocked pain in the front side of her hip. Anatomically, this pinching pain was because the femur was moving forward in the joint and running into the front side of the hip socket. I had to perform a banded joint mobilization for the left hip. With the band pulling laterally, she pushed her knee in towards the midline of her body, moving into the restricted hip internal rotation. She then drove the knee out to the side and squeezed her glutes on that side. The goal with this movement is to create a little bit more mobility within the joint with the banded stretch, and then teach the body how to maintain sufficient lateral glute coordination with the glute squeeze, called neuromuscular re-education. After, we immediately retested, and you can see an instant improvement in her prior restricted hip internal rotation. I then retested her hip flexion.
So before you were about right there? Still no pinch? No pinch, no pinch?
There.
Right there.
Yeah.
So see how much further you're able to get
It's
now?
a lot better,
A
yeah.
lot better. There you go. So that just shows you how helpful that one movement is
Yeah.
with completely changing the mechanics of the hip joint.
Right.
Next, I tested her strength and coordination of the lateral hip muscles.
Great. And I'm going to pull your hip up and back. Hold right here. Don't let me push down. So nice and strong. Good. Okay, same thing on the other side. Okay, hip up and back. Okay, right here. Nice and strong. Don't let me push down. Okay, hold it. Hold, hold, hold. Okay, maybe a little bit weaker on that side?
Yeah.
Okay, so that's another thing that we're gonna work on. Here's the reason. The glute medius muscle that we're testing right there that runs on the side of your hip, it's sort of like the rotator cuff of your shoulder. And its job is to hold the femur within the center of the hip socket whenever it's moving. So we have to make sure that it's working well to centralize the hip socket whenever you're doing like a deep squat. So we're gonna do a couple strength exercises, but we're gonna make it very specific to the motions that you wanna get into. And then we're gonna try to get into a sumo deadlift position today and see how it feels.
Okay.
We started our coordination work with a side plank clamshell. I like this exercise because it's not just working the movement of the lateral hip muscles from the opening motion of the clam, but it's instilling stability of the downside hip as it has to work to limit the unwanted motion of the body dropping back towards the ground. We then move to a banded slow squat, working on engaging the lateral hips with sufficient external rotation torque during the squat. The body has to learn to adapt to the band trying to pull the knees in. And in order to squat without pain, the athlete has to learn to open the hips correctly and move with optimal technique. We then picked up the barbell and worked on some deadlifts from 135 up to 185 that day pain-free. The cues I wanted her to work on is to open her hips and create a ton of tension in her glutes before she pulled the bar from the ground. Overall, pain-free and not too bad for day one.